So, with mental wellness overall, and sort of thinking of in the context that we find ourselves in right now, and the way that we all have this uncertain feeling, definitely off balance. It's really hard to find our a solid ground. Why do you think that organizations like ourselves, organizations, educational institutions, managers, coaches, why is this important that we gain a further understanding of mental wellness overall?
Well, mental wellness is responsible in a considerable way for performance in all areas. Whether it's academics, business, the corporate world, sports, you'll see that every individual that is suffering to some degree with a condition of mental dysfunction, and that ranges from something mildly that's transitory up to something that's of great significance. There was a study, I think it was done by the New York Times about 2 years ago, that said about 85% of the college population suffers from anxiety and or depression. Having been employed in this area for years, it's the largest number I've ever seen. So we know that if there is a dysfunction in the regulations of emotions, of cognitions, performance suffers terribly. I've noticed in one of the research articles that someone who's depressed misses 27 days of work on an annual basis. So one of the reasons why employers, schools, all organizations have a responsibility in helping people identify and accept that there's a condition that influences, because it will affect performance across the board. Now, that could be the bottom line, certainly in corporate America. But when you look at its impact in the educational realm, things like attention deficit disorders or anxiety, and sometimes those get misunderstood, profoundly influence the way in which the individual is functioning and the way in which they see themselves.
Right.
Now, the way in which we see ourselves makes a big difference in our performance. So it starts right there that we have to have a good understanding of ourselves, and others have to be able to help individuals who have conditions like this to allow for it to be acceptable and offer some assistance in order for performance across the board to increase.
So, could we take the time to, as we, and that was a great explanation. Thank you for that. But could we take the time to differentiate between mental wellness and mental illness?
Great question, Paul. Yes. I mean, I think that anyone who is receiving some assistance from a professional, psychologist, social worker, psychiatrist, um, are seen as having some type of mental illness.
Yeah.
Now, a lot of the conditions that we treat are transitory, described as adjustment disorders. So some things that are occurring in adolescence might not be occurring in the rest of adulthood. Now, there is a misunderstanding that if that's the case, and if you've ever been treated, it means that there's a condition that is profoundly influencing you, and it's going to be lifelong.
Right.
That's a misunderstanding. We need to look at this in terms of wellness. How do we function at our highest level?
Yeah, I
So,
like that.
nutrition.
Yeah, I like that a lot. Yeah.
Yeah,
Wellness as equates to performing at our highest level. Very cool.
yeah. So the simple things like you exercise. I know you like to run, and you've played a lot of soccer.
Mhm.
So, and so do your kids. So the point I'm making is, isn't that a sign of wellness? Is that you're actualizing the potentials that you have? Now, that's also true about our mind and our brain. Our
Mm.
brain is the organ. Our mind is the way it functions. So sometimes there are conditions that are in the brain, bipolar disorders, and
Mhm.
sometimes they're in the mind, and stress that is accrued over a period of time, such as COVID, or anxiety about performance, about getting into college. Those are transitory issues.
Okay.
So we need to look at that whole spectrum of wellness and what's really good mental health versus conditions that are described as illnesses.
Okay. So just as a further example, what would be mental illness? Like what are some illnesses that would be more in that category?
Well, certainly we can look at conditions that are biologically transmitted. I mean, bipolar disorder is one of those conditions. Schizophrenia is. But we also have personality disorders, where there's a very long, substantial quality of the way a personality is dysfunctioning and is very rigid and won't change. And that's narcissistic personality disorders.
We know
We also
those.
have anxiety. Sorry.
We know those well here.
Yeah.
Yeah.
We also have mood disorders, things like depression, which might again be resultant of factors that are accumulating over a long period of time, and anxiety. Some depression is a biologically based, endogenous depression.
Mhm.
Others are much more reactive and could have one major depressive episode in your life and not any longer. And then we have things that are mood disorders as well, anxiety, obsessive compulsive disorders, those kinds of conditions, which also have a biological basis to them.
Right. So I think for all of us that will be again going on this journey with you, and we have this series of discussions that we're going to be having, which will be topical based. What do you say then we will be spending more of our time on? Then really, it's going to be more on the mental wellness aspects, which I think what we were talking about for organizations, people that are responsible for others, and even being a better colleague to identify sort of those traits and acceptance so that we can provide a source of comfort and also a greater awareness of understanding so that we can be of greater assistance when needed.
Absolutely. I
Okay.
mean, clearly there are people who suffer conditions that are maybe long-standing and necessitate, medication intervention.
Right.
That's not the focus of what we're going to be working on here.
Right.
Certainly, it's important that corporations recognize that there might be some individuals that are suffering from these situations, and
Absolutely.
to offer, a way to assist them and support them during these
Yes.
periods of time.
And I feel that from an individual's perspective, when we talk about unleashing sort of the human potential, anytime that we are judging or biasing our opinions based on someone and what they may be suffering from, ultimately that may lead us to not being a part of what this person truly can be.
Well, you're bringing up an essential piece that we'll deal with in mental wellness, as well as other conditions of health, which is understanding. And that's an important part. We'll spend more time with that as we've had our discussions before about this.
Yep.
But it's essential that corporations, schools, any organization offer opportunities for individuals, members of those teams, to receive some understanding and assistance,
Yeah.
and to shed this whole issue around whether or not there's some stigma associated with this. Interesting, as millennials sometimes don't get a good rap at times, millennials are far more likely to talk about issues like this than baby boomers are.
Yeah. Yeah.
So we can see that they're willing to take the risk, and baby boomers not so much. But I would say that the culture, certainly the understanding that I know about WIS, fosters the ability to have individuals seek some understanding from leadership. And certainly my experience with working with some of the individuals at your corporation. But that's a really important piece. So the first thing we would start out with in any corporation is making sure that understanding is taking place and there's an accessibility to the leadership. And this has to be in the culture. It just can't be kind of one-off with one member of the leadership team being available. It has to be, corporate-wide.
Yeah, absolutely. All right, great. Thank you very much for that.